Total hip replacement has become one of the most successful surgical procedures in terms of pain relief and improving quality of life. In the late 80s, researchers at St. Olavs University Hospital in Trondheim, Norway, started a program to develop a custom femoral stem prosthesis. Because the results after using various types of standard non-cemented femoral stems were not satisfying, they started a program to see whether CT scans combined with new three-dimensional modeling technology could be used in the development of a new prosthesis.
From the beginning the aim was to develop a stem that was more ideally fitted for each patient. We have done special studies of the stability by using radiostereometry, and we have also been studying the remodeling of the bone by using DEXA techniques.
Researchers at St. Olavs Hospital felt there was a different need for patients with a very special femur. The list is long. For instance, if you have a very narrow or wide medullary cavity, it's difficult to obtain a good fit with a standard stem. In addition, if the geometry is very distorted, for instance if you have a severely increased anteversion of the femur, these patients are in need of a custom-fit stem, such as that provided by Scandinavian customized prosthesis.
Well, I have been working with young arthritic patients for many years. They often have some growth disturbance, which make it difficult from the implant aspect. And so I kept to cement for many years, but the survival was not so good. So I started to use press-fit prosthesis of different kinds, but you never obtain a good contact between the implant and bone. So then I decided to test the SCP prosthesis.
Based on our experience during the first 3 or 4 years, we also found that it was an advantage to use such stems in the more ordinary case. And the reason for that is that we are able to reconstruct a more ideal biomechanical situation by designing an ideal medial femoral head offset for each patient, and at the same time to correct the leg length discrepancy.
Most systems are acceptable, but if you should use them, you have to have hundreds of implants on the shelf. And even if you have a lot of different sizes, you will always have some patients that doesn't accept any of them. And then it's of course better to customize it.
Data shows that young and active people are more susceptible to revisions, probably as a result of their active lives causing increased wear of the acetabular component. Several researchers have addressed the need for custom-made implants for these groups of patients. Professor Benham and co-workers at the University Hospital in Trondheim made various designs of the prosthesis after years of experimenting with cadaveric femurs. The cooperation with St. Olavs Hospital and the establishment of Scandinavian Customized Prosthesis, SCP, made it possible to implant the first individually designed prosthesis in 1995. Since then, more than 1,000 men and women have achieved pain relief and increased quality of life with the unique stem. The design of each stem is made by highly skilled technicians using computer tomography pictures to create a three-dimensional model of the femur. In order to assess the bone density, a proprietary technology is developed to discriminate between trabecular and cortical bone, using 600 Hounsfield units as threshold for the contour of the prosthesis in the proximal femur. To achieve the best cortical contact, the stem is coated with a plasma-sprayed 350 micrometers porous titanium layer and a superficial 50 micrometers hydroxyapatite layer.
I experienced the wonderful sound of final cortical contact when I performed my first SCP prosthesis, and that was a nice experience. Preoperative planning is of utmost importance, and every time you forget it, you are not happy during surgery. It's very important.
Ordering the custom stem is an easy process. By going online and logging on to UniqueNet, the orthopedic surgeon can fill in the necessary patient details, starting off the process of fitting the product at SCP's lab. When the design is ready, the orthopedic surgeon can access and adjust the position of the prosthesis in a web-based template. UniqueNet offers an easy-to-use interface accessible from any computer connected to the internet. The on-screen tools make it possible to adjust the position for both the acetabular and femoral component. A template guides you so you can be sure the new rotation center facilitates a favorable neck design. When the surgeon has performed the preoperative templating, pushing the submit button initiates the production of the prosthesis.
The pre-op planning system provided by SCP is very easy to understand, and I use it. But the funny thing is that when I get the suggestion from the company, it's almost always as I want it.
The advantage of using customized femoral component is that it gives us the possibility to correct small medial offset of the femur. It will also correct an increased anteversion of the femur. And of course, leg lengthening or also a certain degree of shortening is possible by using such implants.
The surgical procedure is not very different from implanting a standard stem. The main difference is use of a custom resection guide, which is necessary to ensure a correct resection level, and the use of a custom broach to create a perfect fit for the stem. A set of documents providing the surgeon with important preoperative data is included.
The instruments that comes with the SCP prosthesis are very few and very easy to use.
The reason for why I'm using the customized femoral stems are the great advantage these implants offers me when I have difficult cases where the anatomy of the patient differs from a standard situation.
I have had patients with very severe growth disturbance of the proximal femur where I could not use any implant on the market, where the SCP stem has solved the problem, so to say.
More and more orthopedic surgeons are now converting to the unique customized stem. The list of advantages seems to only increase as time passes. The patients get the best treatment with the best possible fit, which will ensure absolute stability and a longer life expectancy, which limits the need for additional surgery in the future. The possibility to change and optimize hip geometry results in more mobility and less muscle strain. In addition, the post-op follow-up ensures quick recovery, mobile and satisfied customers. Also, the benefits for the surgeon are numerous. First of all, the excellent pre-op planning system reduces time during operation and also aids the surgeon, making it easier to obtain a perfect result every time. In addition, due to SCP's commitment to state-of-the-art technology, most surgeons praise the accessibility online and the customer support. These benefits also reduce cost at the end of the day.
I will continue to use this prosthesis because of the excellent service from the company in the planning. The implants I have received so far has shown a perfect fit to the patient.
The development of the unique individually designed stem is a significant step forward for patients suffering from diseases that make it difficult to use standard implants. Not only pain relief, but also the ability of participating in daily and social activities is now possible for the most challenging patients. Scandinavian Customized Prosthesis offers full support, which includes surgical assistance, educational assistance for surgeons and staff, and instruments. Get started. Bring a better life to all of your patients.